Hi everyone, I'm Adria Berry and I'm the Executive Director of the Oklahoma Medical Marijuana Authority. We are the regulatory body that oversees the medical marijuana industry in Oklahoma. I'm here today with Executive Director Rachel Holt of the Office of Juvenile Affairs, and we are going to discuss today some of the exciting things that have happened the past year as we've been able to work together. So tell us a little more about your role and your agency.
Sure. The Office of Juvenile Affairs is Oklahoma's juvenile justice agency. We are in the Human Service Cabinet, so we believe that our goal is to help families and children who are at risk or involved in the juvenile justice system to prevent them from deeper penetration into our system or into the adult system, and to give them productive and healthy futures. We do that through prevention, treatment, and placement throughout the state. We work in all 77 counties, and we are thrilled by the work we do every day, but very excited about this opportunity you've provided us.
Well, that's great. Man, you really get in early on and try to help change the path for some of Oklahoma's children, and that's exciting, and it's great to know that we're working on that every day.
Yes, we at OJA work with our youth service agencies, 39 designated youth service agencies across the state that provide services to children within their community, not just justice-involved children, but children in schools, and we really want to focus on prevention so that we aren't first meeting them in a courtroom. We'd like to get them before then so they never have to enter a courtroom.
Oh, that's great. Well, I wish you all the success, and I know you're doing great over there. And one of the things that I was told when I came into this role in August was that we had some money sitting aside, and we were working with you guys to get the money from our agency to your agency. And part of that goes back to the state question that created the medical marijuana industry in Oklahoma and the entire regulatory framework. And that state question mandated that 75% of any excess over what it takes to run the agency goes to education, and then 25% to mental health and substance abuse programs. So I know at this point we were able to send $2 million over to OJA, and I was hoping you could tell us a little more about how that is going to help in the prevention side of things that you do.
Yes, we are thrilled. The Office of Juvenile Affairs is going to use that $2 million to stand up functional family therapy, or FFT, which is currently in 45 states and 12 countries. So Oklahoma will be joining all of those other states that have seen what happens with functional family therapy. Functional family therapy is used within the family structure for children that are showing substance abuse and disuse, and also some prone to delinquency or at-risk behaviors. And so with functional family therapy, the clinician works with the child and the whole family, including any siblings in the home, to provide services and clinical interventions to put them on a better path. It has been shown to greatly reduce recidivism, to keep kids safely in their homes, in their communities, and to really be game-changing for the whole family. Without this funding by OMMA, this would not have come to Oklahoma. This $2 million is game-changing for the state of Oklahoma, is game-changing for children and families. To stand this up, there is a large cost, and without this gift, without this grant, obviously it hasn't come to Oklahoma yet. And so with this $2 million, we have put an RFP out, and we will identify agencies, hopefully across the state, that have clinicians ready and eager for this training. And then there's a 3-year training process through Functional Family Therapy International will come in and do the training for all those clinicians. And they will begin taking clients very soon in that training within the first few months, and then continue that training for fidelity to the 2nd and 3rd year. So we are so excited. We know clinicians that are applying for this grant are so excited for this opportunity to have this training for free.
Oh, that's fantastic. I can't wait to see some results from that and see how that really impacts children and families across Oklahoma. And it's so exciting to be a part of that. So thank you for sharing that information. At OMMA, we hear from a lot of people across the state, parents, doctors, that are concerned about the access that young people have to medical marijuana or marijuana products since the legalization in 788. What are you seeing on your side, and how do you hope that this funding and this program will help address some of that?
Substance abuse has always been an issue with Oklahomans. We're high for it in the state. It's generational issues, substance abuse. So the state question and medical marijuana hasn't changed. That is always and will continue to always be an issue with children and families in the state of Oklahoma. But what we're excited about is this ability to have a modality in homes, working with families, breaking up that generational pattern of substance abuse and really allowing children to be free from it and lead productive futures.
That's really good to hear, and it's good to hear that you are I can feel your excitement and your optimism for this program. So when we talk about that $2 million, that comes from the excise tax. It's 7% excise tax paid at the dispensary level every time there's a purchase of marijuana or marijuana products. So, when we think about the future and continuing to work together, what is your vision on the way we can utilize some of that excess? Because, we use a portion of that to fund our operations and our staff and those kind of things, but the excess goes to education and mental health and substance abuse programs. So how can we continue to work together in the future? What do you think?
Well, I'm already excited. As I said, our RFP just closed, and so we already have strong candidates that will start this training in June. So we're excited to get that started. So I'd love to see this funding continue annually, and after we get this first cohort of agencies across the state doing it, will hopefully spark interest for more and more agencies to want to be in additional cohorts with additional funding. And then as we really stand this up and have functional family therapy in the state of Oklahoma for families in their communities, we can see what other gaps are within the community and what other programming is needed directly in schools. At OJ, we really believe and strive to meet kids at the prevention phase rather than on the deeper end phase.
Yes, I think that's so needed. As you said, the historical data about Oklahoma it points to that. If we can get to children early on, we can change their trajectory, and it's just great to know that you're working on that.
Yes.
Well, Rachel, thank you for coming today to talk about this new program, and I can't wait to talk to you again once it's up and running and we can discuss some of the outcomes and the good things you're seeing and the positive impacts on Oklahoma. I'm really excited that we're able to take our first foray into a program like this now and work together on it. So thanks so much.
Thank you. And again, at OJ, we are so excited about this program. This functional family therapy in the state of Oklahoma would not have happened without this funding. So thank you. Thank you for your leadership, and thank you to OMMA.
Thank you for joining us, guys. Look forward to sharing more in the future.